This video shows you how to perform Station 2 illumination techniques for the slit lamp proficiency. So I'm going to start with my optic section of the cornea. Right now I'm just adjusting to find 16x mag. I'm a little too high here, so I'm about to turn it down another click to 16. There we go. And now I'm focusing my optic section on the cornea and scanning from the temporal limbus all the way over to the nasal limbus, flipping my light source to the nasal side as I cross the midline, maintaining focus the entire time. And then I'm going to scroll up because I wasn't able to see the superior part of the cornea during that first scan. So I'm having my patient open wide and scrolled up to then rescan the superior cornea with my optic section. Now I'm widening the beam to a narrow parallel pipette, and I'm going to repeat the same process. So starting at the temporal limbus, scanning in focus across the entire corneal tissue, and again scrolling up at the end to repeat that procedure on the superior cornea. Remember, if your patient cannot open wide enough to see the entire cornea, you should use your hand to pull their eyelid out of the way. Next, I'm going to perform specular reflection of the cornea. So I'm going to take my parallel pipette, not changing anything about it, just regaining focus on the cornea. I'm going to find that specular reflection. I turned down my brightness a little to make it easier to view the endothelium, and I magged up to 25, and I'm holding that view of the endothelium on the right side of the beam there for about 3 seconds. Next, I'm going to perform anterior chamber eval. So I've darkened the room fully. I would be dark adapted as the examiner. And I'm going to shorten my parallel pipette to about 1 to 2 millimeters tall. And here I'm trying to find that space between cornea and lens without hitting that specular reflection on the left or that iris on the right. Now, this is challenging at this angle for me, so I decide at some point to switch over to the nasal side, and that gives me a better angle to approach this technique without hitting those reflections. So here we go. I just flipped to the nasal side. I'm going to retry. So on 10x, I'm focused on the cornea. Now I've pushed in to focus on the anterior lens, and I'm pulling back halfway in between, so I'm focused in the anterior chamber. I'm magged up, and I'm just going to readjust my focus, cornea, lens, halfway in between, and now I would say the chamber is deep and quiet. I'm going to repeat the procedure with a conical beam. So here is my conical beam, 10x, focused on the cornea. Now I'm on the anterior lens, and I'm halfway in between. Gonna mag up to 16. You don't have to refocus if you're still in the same spot, but I'm just showing you again how to refocus at that higher mag. And you would state that the anterior chamber is dark and quiet, or deep and quiet, I apologize. And next we'll do transillumination of the iris. That's our final skill. So I've moved my light beam at about a 0-degree angle, pretty much in click. I've heightened my parallel pipette to make it fit or about the size of the pupil. It can be a little larger or smaller. And I do have retroillumination here, but it's really hard to see on the camera. So I decide to flip my light source a little bit more nasal and go to the nasal edge of the pupil. You'll see in just a moment. And then you'll be able to appreciate that subtle orange glow. I recommend using a slightly taller beam, a little wider if necessary, to make that visible. And there it is. And then you're done.